Welcome back. This is Dave.
And Joyce, and I want to thank you for joining us in the Power Hour today, and I want to thank you for purchasing from the Power Hour. Now, we have not talked about the palm oil, the red palm oil with Bruce Fife, which we want to get to and touch upon that because it is an amazing type of fat to use that improves blood circulation, protects against heart disease, protects against cancer. It improves blood sugar control. I mean, it does so many things. Red palm oil is amazing to cook with. If you use it in your food, frying your food can actually make it healthier for you, believe it or not. Like potatoes, fried potatoes, stir fry with red palm oil and coconut oil, either one. I use them interchangeably many times, and sometimes I use both. But the book, Oil Pulling, is a must. I mean, this is a must. Even if you want to buy it and find out it doesn't work all that much for you, it's going to do something. It's going to clean out your mouth, I guarantee you. Not that you have a dirty mouth, but everybody does. Now, we have in the studio with us one of our Power Team members who did the oil pulling for the first time last night. Now, Bruce, as you know, when you start to talk about this kind of thing, people look at you like, oh my gosh, where has Joyce gone wrong this time? And they tend to think, oh, this one, now she's been right on a few things, but this one's like really crazy. Well, people were kind of surprised at me, and so we had one taker on this because she picked up your book, and I want to introduce Jessie to everybody. Jessie picked up the oil pulling book, and she said, I can't put it down. Now, what was it about it, Jessie, that got your attention?
Well, actually, I was about 10 pages into it and realized all of the bacteria that was in my mouth, and I'm like a real clean freak when it comes to my mouth, and realizing that brushing and flossing and everything really wasn't even taking the bacteria down made me just want to go home and try it.
And so she tried it last night for the first time, but you said you couldn't quit reading this book. Have you pretty much finished it?
Oh, yeah, I finished it in an hour yesterday.
That's amazing. And the book is called Oil Pulling Therapy. Now, what happened now, first of all, did you find it a little strange to be putting a tablespoon of coconut oil in your mouth?
At first, when they were, putting oil in my mouth, I thought, I don't know if I'll be able to do that because I'm kind of a texture person, but it really wasn't that bad at all because I like the taste of coconut oil, and 20 minutes really does go by fast when you're doing other things. Like I washed my face last night and was swishing coconut oil, so.
Mm-hmm. And when you're doing it, it liquefies, and you don't even realize it's just like a liquid in your mouth, or like a sort of liquid oil water after that. But you really don't even think much about it, do you?
No, not really. It's just, you just keep swishing, and then it gets easier and easier, and then it turns, you're supposed to wait, I guess, until it turns like a milky white, and that's how you know that you're swishing effectively, so.
And then you spit it out.
Yep.
I'm proud of you, Jessie.
I am too. I was really amazed.
Yeah,
now,
Jessie came to the Power Hour about a year or so ago, and of course, a lot of the stuff that we have here, a lot of the products were like anybody. If you've never heard of this stuff before, it's like really alien to you. I mean, it's totally different from anything that you've been told and you've been brought up with, you know. And Jessie, I'm sure you were sort of the same way, weren't you?
Well, yeah, I was kind of
skeptical.
Blinded by everything. Really, I had no idea. I mean, I'm only 23, so I'm still kind of young, and all the stuff that I've learned out here, it's just amazing.
Now, what happened? You said that after you did the oil pulling, you had a response to it. What happened?
Well, actually, today I have this may sound gross, but it's kind of mucusy, kind of hacking up mucus, and they said that pretty much is already detoxifying my body. It's pulling toxins that fast from doing it just one time.
Wow. Let's ask Dr. Bruce Fife. Is that a response to doing oil pulling, to have a lot of mucus?
That is one of the most popular type of responses, and that happened to me the very first time I did it, too. I was able to cough up a lot of mucus and clear out my sinuses and my throat of this disgusting stuff. And when you start doing it, when your readers or your listeners start doing it, that is one of the typical symptoms they'll get, or one of the cleansing processes they'll go through, is getting rid of this mucus.
Now, that's pretty amazing, doing it only one time. And you are very healthy. I mean, you probably keep close to a vegan diet or vegetarian diet and probably don't do a lot of unhealthy things. But for you to also have an impact from this or an experience from this, that's pretty amazing, Dr. Fife.
You know, that is very interesting because I do eat very well, and I do go through lots of detoxes. I do a lot of fasting, up to 30 days, you know. And when I did the oil pulling, I was amazed that I went through a cleansing crisis almost immediately, and it progressed from getting rid of this mucus to my voice actually went on me. I had laryngitis for a couple of days as my body was cleansing these toxins out.
Yeah, it is really incredible. And there's a number of testimonies in this book that are so compelling. I mean, you read these, and I have to ask you, how did you find the testimonies that came forward, the people that came forward in this book?
I just went on the Internet. I talked to people who have called up, and we've talked about it. They've tried it, and so I've got them here and there from everywhere.
Well, you know, and one thing I wanted to mention is that when I was doing it with, and I stopped doing it, and I'm not quite sure why, but I was doing it at one period of time using a drop of peppermint oil. Now, I notice in your book you recommend 1 to 2 drops of oregano or clove oil. Now, why would that be?
Well, you know, for a lot of people, putting the oil in their mouth is disgusting because they just can't handle it. So I do recommend for those people that are starting off, that have a hard time, if they want to make the oil a little bit more sweet or tantalizing, to put in a little peppermint or spearmint oil, a drop or two, and it makes the oil very tasty. Now, my recommendation for the oregano oil or the clove oil is for people who have some dental issues. I have in my book a formula called medicated coconut oil, which includes a couple of drops of clove or, you know, oil or oregano oil, because they are very antiseptic. They will kill the germs in your mouth, and that's why I recommend it.
Yeah, we need to talk.
You don't always have to use that.
Mm-hmm. Yeah, in fact, you don't have to use it at all if you don't want to. And
right.
we will talk about the effects of the dental on the mouth from the standpoint of the teeth in just a second. But I just want to say thank you to Jessie for coming in today. Now, Jessie, will you continue doing this, do you think?
Yeah, actually, I think I'm really interested into continuing it and see pretty much the outcome of what it's going to do.
How many times do you recommend that a person do this a day?
For basic maintenance purposes, once in the morning before breakfast. But if you have some health problems, some dental issues, then I recommend that you do it up to 3 times a day before meals.
Mm-hmm. And how long is it usually before someone starts to see some kind of positive result?
You know, it could be a couple of days, or it could be a couple of weeks, or a couple of months, depending on the person and the conditions that they have.
Okay.
But you know, one of the very obvious things that happens when you start doing oil pulling is the improvement in dental health. Your teeth will get whiter. Your gums will get pinker, not inflamed, but they'll be a healthy pink. Your breath will smell better. If you have a chronic bad breath problem, that's because you have populations of bacteria in your mouth that you should not have, and this will get rid of that. If you have tooth decay and such, this will all help improve the mouth tremendously.
You know, you have testimonies in here regarding hormones, regarding fibromyalgia, diabetes, blood sugar. I mean, it seems too good to be true when you look at it, but I think once you read this and you understand the mechanism behind it, which you really do need to read the book to find out why. For instance, the cases of aches and pains of the body, neck, and head, allergy problems, skin problems, digestive problems. You'll start to see sort of why the underlying principle works for doing this oil pulling step by step. So I thank you, Jessie, for joining us today on the Power Hour. And you're going to keep doing it, huh?
Yep.
Good girl. Well, thank you so very much for coming over and sharing that with us.
All right.
And Dr. Fife, let's talk about the dental issues. Let's talk about what it does for the teeth when you do this.
You know, I'd like to just touch on Weston A. Price again, because he did so much and established on a lot of the basic groundwork for this, and really introducing me into the connection between oral health and systemic health. In his 2-volume set that I mentioned a little bit earlier, he has many studies in there where, for example, a patient came to him who had crippling arthritis so bad that she had to use a wheelchair. Well, he suspected that her root canal was infected, even though X-rays didn't show any infection present. He was at this time suspecting that root canals always remained infected, no matter how well they were cleaned and disinfected. So he pulled the root canal from the patient. Well, within a few weeks, this lady actually healed from her arthritis to the point that she no longer needed her wheelchair. Her hands improved, that she could do needlepoint again. But even more amazing than that is he took this tooth that he extracted from her and he disinfected it, he washed it off, and then he inserted it under the skin of a rabbit. Within days, that rabbit developed the same crippling arthritis that the woman had.
You know, that's what I was referring to at the break earlier, taking something and putting it under the skin of an animal. Think about that, taking a tooth and putting it under the skin of a rabbit, and what happened?
The rabbit developed the same health problems that the lady had. Now, this is just one study. I mean, he has hundreds of similar studies. He would take patients, when he took the infected teeth of a patient with kidney trouble, the rabbit developed kidney trouble. With eye trouble, the rabbit developed eye trouble. Heart problems, ulcers, bladder infections, colitis. He had a patient that came in that had colitis so bad that he had bowel movements every 30 minutes. Well, he removed the infected tooth. Well, this person, over a couple of days, all of a sudden healed from his colitis. He took that tooth, he washed it, and then inserted it in a rabbit, and that rabbit developed severe colitis.
This is incredible. This is like a missing part of what we should have known all along, and explains so much about why we might be ill. Think about that, ladies and gentlemen. Whatever particular type of bacteria growth you have in your mouth might be causing that particular type of disease. And then to think that he takes a tooth out of the mouth, puts it under the skin of an animal, and they develop that problem. This is like an aha experience.
Definitely, yes. So this bacteria, that we have in our mouth is constantly coming into our bloodstream and collecting in different parts of the body. Now, as I mentioned, it can collect in your heart. It can collect in your joints to cause arthritis. It can collect in your blood vessels, and it does. And when it does that, we have bacteria in our mouth that cause plaque to form on our teeth. This very same bacteria, when it gets into our bloodstream, will attach itself to the inside lining of our arteries and cause plaque to develop inside the artery wall, thus forming atherosclerosis, leading to heart disease, heart attacks, and strokes.
Amazing. Just amazing. To do something for 20 minutes that might be the causative agent or remove the causative agent from many of the diseases that we have. Now, there's only one rule, and that is don't swallow the coconut oil. That's really important, ladies and gentlemen, because once you dislodge all that bacteria, you don't want it going down into the gut. Now, let me open up the phone lines here real quickly. If there's anybody who has a question or perhaps has done oil pulling out there that would like to give a testimony, the testimonies are what we would really like to hear right now. 800-259-9231. Unfortunately, we'll only have time for a couple. 800-259-9231. Now, is this something that you are doing on an ongoing basis, Dr. Fife?
Definitely. I do it every day. I'd also like to also mention, I talked about Weston A. Price. I mean, he did this back in the 1920s and published this research, but research right now is also going on. We have studies that are being published today that also confirm this connection between oral infections and heart problems. In fact, if you go to a dentist, if you have any heart problems, they are required to give you antibiotics to protect you from the secondary infections from your mouth. Mm-hmm. This is well known in the medical world.
That's right. Absolutely. And the risk of getting pericarditis as a result of having teeth work done when you have an infection is very, very well known and documented. One other thing I wanted to mention is the heavy metal detoxification that you focus on page 142.
Yes, unfortunately, we have something called amalgam fillings that have been put in our mouth. Now, amalgam fillings are primarily mercury, and as you know, and most of your listeners know, that mercury is very toxic, extremely toxic. So why do we put it in our mouth? Well, it's going to emit vapor that we absorb into our bodies that are going to cause a lot of health problems. And so I also include in the book a mercury detox that you can do if you still have mercury fillings in your mouth.
Excellent. And I know also you have a good listing here of the food's potential for tooth decay. And I know that it's not just necessarily sweet items as we might think, but this is really a good educational book for children also. Wouldn't it be great to start children? Because I know you mentioned how much bacteria is in a child's mouth, and already they have the potential for developing caries or dental cavities as a result of that. We're going to be right back after this 3-minute break. We'll take a couple of phone calls, 800-259-9231. Have you done it? Did it work? Give us a call. We'll be back with Dr. Bruce Fife. This is Joyce and Dave.